everyone. We'll just give it a minute. I think people are still connecting to today's community forum. First of all, I want to thank all of you that are present today, joining us for our bi-weekly informational session. So I will just give it a minute here. Well, since we started recording, we'll go ahead and get started. Good morning, my name is Rocio Ramirez and I'm with Imperial County Public Health Department. I am the Community Health Division Deputy Director. I will be providing today's community update on behalf of our Director, Jeanette Angulo. With me today is also Jorge Torres, who will be assisting us with the update and providing us some information as to messaging and information that's out in our community. Let me see if I can share. So today's update, we'll go ahead and get started with just a dashboard update in terms of our case numbers. Total tests as of today have been 127,859. In Imperial County, we've had 101,959 negative tests. Total positive tests have been 25,900. Active cases documented is 106. Recovered cases is 25,072. And deaths are at 722. If you want to get more information related to our COVID cases, you can find information related to by location on our dashboard, more breakdown in terms of demographics of the actual cases, as well as death timeline and data. And so just wanted to give you a brief update on that. Some of you may have noticed in recent days there have been some fluctuation in the numbers, especially related to the deaths in our dashboard. We have been made aware of the situation. There has been some issues with the statewide data reporting system that feeds into our dashboard and our system. So they're trying to identify what the issues are so that we don't see those kind of fluctuations. We will continue to monitor the data and identify any discrepancies that are found to try to mitigate those as soon as possible. And we do want to appreciate your patience and apologize for any confusion that some of that information may cause. We do auditing of our data on a daily basis, and just to also let you know that some of these cases we do ongoing checking the data and doing data cleanup, so that may also be reflective at times in our total positive cases if any duplicate records are found, for example, and so forth. But I think where we see that the majority of times is on deaths. Just as a reminder, all cases remain active, and we do investigate all deaths to ensure the accuracy of the reporting that the cause of death is due to COVID and is documented on death certificates. As of this week, the Imperial County tier assignment and metrics remain on the orange tier. The county metrics indicate 5.5 new COVID cases per day per 100,000, 5.2 adjusted case rate for the tier assignment, 3.0 positivity rate on a 7-day average, and 4.4% health equity quartile positivity rate. So we'll remain on the orange tier. In terms of vaccination, doses administered in Imperial County, total doses administered to date is 121,600. Partially vaccinated are 69,123. Fully vaccinated are 52,477. So this equals 236.07 partially vaccinated and 27.38 fully vaccinated. In here as well, on the dashboard, you can find more information as to more details per city, some of the demographics of those that are being vaccinated based on partially vaccinated and fully vaccinated data, if you want to look at more in-depth information on that. I know some questions have been asked before if these numbers indicated the fully vaccinated and partially vaccinated numbers indicated if they are only those that were vaccinated in Imperial County and Imperial County residents versus those that may have been vaccinated outside of the county. Our numbers do indicate all Imperial County residents, whether they were vaccinated in Imperial County or outside of the county, as long as it was within the state of California. We all use the same system where the immunizations get reported, and we're able to pull this data. However, those that may have gone vaccinated out of the state of California, those numbers may be missing. Also, just as an update, on May 13th, we shared that Pfizer vaccine has been authorized for individuals 12 to 15 years of age. The Food and Drug Administration announcement this week of the authorization of Pfizer BioNTech COVID-19 vaccine for emergency use for individuals of this group was released. Officials from the Center for Disease Control and Prevention and the Western State Scientific Safety Review Work Group recommended the use of the vaccine for the 12 and 15-year-olds on May 12th. Imperial County starting Thursday, May 13th, the Pfizer vaccine became available for individuals 12 and over in various locations in Imperial County and throughout the state of California. We want to encourage people to continue to get vaccinated. The more people are vaccinated, the more that we reach to immunity throughout our community. I went ahead and indicated here just some of the frequently asked questions that people may have related to vaccine safety related to this group. And so just indicating our vaccine safe for use ages 12 to 15. Clinical trials of Pfizer were found to be safe and effective in protecting against illness, hospitalization, and death among those aged to 12-15. Pfizer phase 3 clinical trials enrolled 2,260 adolescents in the US and demonstrated 100% efficacy. There may be questions as well as whether if children have reactions to other vaccines, should they get vaccinated? We would really encourage you to talk to your healthcare provider and the pediatrician in advance of receiving the vaccine to ensure that there is no issue in getting the vaccine. Although allergic reactions to COVID vaccine are rare, very few people may have severe reactions. So want to ensure that if the child has a reaction to a component of the vaccine, that they don't receive it. Otherwise, it should be safe. And so why is the vaccine only for adolescents 12 and over? And when do we expect vaccines to be available for younger children? Vaccine trials usually commonly begin with the most vulnerable populations and those that may be at higher risk, and then extend into the younger ages. Adolescents were in the next group of prioritization because they're more similar to the adults and more likely than the younger kids to spread the virus and become more seriously ill. So therefore, the trials have been in stages and will continue moving forward. When and where can I sign up to get my child vaccinated? You can book an appointment through MyTurn, calling the California COVID hotline. Also, reaching out to your pediatrician and doctor to get more information on where they can get the vaccine. As a reminder, consent from parent and legal guardians or other adults having the legal custody of the minor must be obtained before vaccination. So consent will be required. If someone else takes the child to get vaccinated, another adult, they will need to show proof of consent of the parent or legal guardian, and that person that consent may be verified through a phone call or other methods, depending on the provider that's providing that vaccine. Jorge, do you want to talk to us a little bit about the Together to Immunity campaign?
Yeah. Hi, everyone. Good morning. My name is Jorge Torres, and I'll be providing a quick update on the Together to Immunity campaign. So the Together to Immunity campaign, it's a campaign to encourage Imperial County residents to get vaccinated. So the way that this campaign got started is through the vaccination ad hoc work group. There's a communications work group that talks about, discusses ways to encourage people to get vaccinated, and we talk about how to do messaging for the community. And we wanted to have a campaign that was local. The state of California had created the Let's Get to Immunity campaign, and we wanted to have something local that really people could really see that it was local people that are getting vaccinated. So the work group decided to call the campaign Together to Immunity, and the action is to get vaccinated. So some of you might have already seen some of this, some of these graphics. I think we have this billboard, this cover photo on our Facebook page. We have been releasing some of the graphics as part of our social media messages. And as you can see, it provides like that friendlier, it's more welcoming. The colors are, nice and vibrant. And it's, to encourage people to get vaccinated. We're trying to stay away from showing like the needle, and make it more, more accessible for people. Not accessible, but more friendly for people to want to get vaccinated, not intimidating. We also created a landing page. So the landing page, if you go to our website, icphc.org/Together to Immunity, there are a couple of resources there. You can also find the vaccine dashboard that was showed earlier in this presentation. And it just provides a snapshot of kind of where we're at and what we're aiming for, right? As far as the people that are getting vaccinated and kind of the accomplishments that we're doing together as a community. And this campaign, it's if you see the billboards and the videos and all the things that we're working on, we're using local people. We're using community members that have volunteered to be part of this campaign, and we're also trying to reach some of these people that have a good following, so that people could see that if so and so got vaccinated, maybe it's I also want to get my vaccine as well, and trying to address some of these so we have 3 core messages, which is we talk about the safety, the efficacy, and the cost of the vaccine. So if there's any doubts regarding those messages, a lot of like the frequently asked questions from from social media, from our call center, we try to incorporate some of that messaging within the campaign. Next slide. And talking about getting vaccinated, so we have as you can see, some of our template changed a little bit. We used to have some of our community clinic flyers to look a little different, so now we put some of this new branding. For next week, we have a couple of clinics that we have planned. So we have some in Heber, Brawley, and Calexico. Some of the clinics are specific for the homeless population. But if you haven't gotten your vaccine, I think this is a good opportunity for you to get vaccinated. So I guess right now we're looking at several places throughout the county. If you want to register ahead of to get your vaccine, you can go to myturn.ca.gov, and we'll actually talk a little bit more about MyTurn right now. And then, or if you're trying to find, if you can't find a specific appointment that fits your needs or fits you, you can also go to Vaccine Finder, and then there's some more options there as well. And if you're having trouble registering on MyTurn, you'll see a number to call, and I'll go through that right now. But there's also walk-ins, so we're encouraging people to walk in. If you just didn't have time to register for the vaccine, or you thought it was complicated, you don't have access to the internet, you can always walk in, and we can go ahead and help you out with getting your vaccine. Thanks.
Just before we move on, just as a reminder, the health department has also had some fixed sites. Usually they're at the Department of Social Services. These, the clinics that you see here are more of the mobile clinics. We're trying to reach the community more where they're at, bring those clinics in a closer to them. But we usually have those fixed sites. OptumServe site is also made available in Imperial at the Veterans Hall, and they also do open on Saturdays as well. So again, like Jorge said, you can find that information on MyTurn based on the vaccine that may be available. I also wanted to make a comment in case anyone gets any calls from our department or regarding reminders. Our department has been working with, we have California Department of Public Health staff have been redirected to assist Imperial County Public Health Department throughout this pandemic in various ways. For one, they've been assisting us with case investigations and contact tracing opportunities. They communicate with those that we're doing case investigations on that come out positive, or again, contacting those that may have been exposed to encourage them to get tested. These individuals, a lot of them have been getting training to assist us with some outreach efforts as well, to help do calls and remind people that may have missed their appointment or may be late for their appointment. So some of these individuals we've started doing these phone calls as of last week. So some individuals may be getting those calls. Again, we just want to encourage people to get their vaccine when it's their turn to get their vaccine, when it's their second dose, turn to get their vaccine, to try to stay on track. And if they haven't, to try to understand, why is it that you're not getting that second dose, and how can we help answer some of your questions and encourage to complete that second dose so that we can have people fully vaccinated. Those numbers are not very high of those that have missed those doses, but there are a couple people there. From what we've seen, a lot of them have their scheduled appointments, so they are doing a good job and working at it. And we do want to appreciate our community for being consistent and following up and really trying to get fully vaccinated.
And so here we have a screenshot of the MyTurn. And so if you're familiar with MyTurn, there has been a couple of changes to MyTurn. I feel like it's become a little bit easier to navigate. They've done some redesigning of the website. It looks a little different. I think there's some like call to action, like where it says start here, so it's easier, I feel like, to start it out. If you scroll down, this is just a screenshot of it, but if you scroll down on the website, there's different options. So it has the option to look at if there's any clinics that are any walk-in clinics. So it looks right there where it says walk in, find now. You can go ahead, if you click there, and if you go down to the county, so there's several clinics that are accepting walk-ins, and you can see that they have the 3 different vaccine options. So we have the Pfizer, Moderna, and the J&J. And then they also have the regular options of just booking your appointment. If you want to go ahead and book it, you can go ahead and do that. And it talks a little bit about the different options, and it has also an FAQ. I thought that was pretty key. The FAQ that I want to point out is, are there other ways to book an appointment? So if you click on the third one, there's a COVID-19 hotline. You can go ahead and call that number specifically, and they can assist you with registering for your vaccine. And that option wasn't available before. And I think that's really helpful for people that are just having trouble with the system, or there's something that you get stuck on and you need someone to talk to. You can go ahead and call that number, and they can go ahead and guide you and help you get your appointment ready. And just going back to the screenshot, so there's also another feature. So if you need any transportation, so if for whatever reason you don't have any transportation to get your vaccine, there is a question when you're registering that asks you if you need help with transportation. If you put yes, that information gets sent over to the public health department, and we can go ahead and see how we can coordinate, either whether it's coordinate transportation with you, or if you're homebound and you can't you can't leave your home, we can see if maybe there's a way to also coordinate if somebody can go to your house and get your get your vaccine. So making it a lot easier and more accessible to get the vaccine. I think these are some of really key steps that have been taken to ensure that people are getting vaccinated.
And we would like to remind people, as it relates to transportation to vaccine clinics, to also reach out to your insurance provider. For example, those that might have Medi-Cal and are part of a managed care plan. Managed care plans provide transportation assistance to vaccination appointments. So that's a way that you can get to a vaccine clinic if you need assistance with that. And there are other formats that we can reach out to. I know that also through senior programs, through ICTC, Imperial County Transportation Commission, I know it has some senior programs that provide transportation to seniors to their medical appointments at a low cost or minimal cost. So that and I believe now through the AAA, they are also be making available free transportation to vaccine appointments as well. So that's another place that you can also reach out to if you use the Access Transit service as well.
And then, so as things are slowly going back to this new normal, right? And you're getting vaccinated, there's a couple of things that people who are fully vaccinated can now do. So there's been some changes to some of the guidelines, and I'll go ahead and review some of those. So if you're fully vaccinated, you can spend time with other fully vaccinated people, even indoors, without wearing masks or physical distancing. And we'll talk a little bit about a different scenario right now, but this is more of like the private setting. Spend time indoors without masks or physical distancing with unvaccinated people people from a single household who are at low risk for severe COVID-19 disease. And so if you've traveled during the pandemic, things have changed a little bit as far as the guidance. So if you travel in the US, you do not need to get tested before or after travel or self-quarantine. And that was something that people had to do when they were traveling during the pandemic. If you do not need to get tested, you do not need to get tested before leaving the US unless your destination requires it. You still need to show a negative test before boarding an international flight to the US and don't need to self-quarantine after arriving in the US. So if you're fully vaccinated, people can take part in outdoor activities and recreation without a mask. So that's like if you're going out to like the park, or if you're doing any type of physical activity and you're outside. But this excludes it if you're in certain crowded settings or venues. So I guess like rule of thumb is if you're near a lot of people, it's safe to say that you should continue wearing your mask. And in the workplace, so those employers subject to the Cal OSHA COVID-19 prevention emergency temporary standards must ensure that employees are following the current emergency temporary standards, face coverings, and testing requirements. So in summary, I guess you can resume activities without wearing a mask or staying 6 feet apart, except when required by the federal, state, local, tribal, or territorial laws, rules, and regulations, including your local businesses and workplace guidance. So if your workplace requires you to go ahead to continue wearing a mask, you must continue wearing a mask. And if the state, so for example, in the state of California, if the state of California still has that guidance, you must continue wearing your mask as well. And as far as also the testing, if your workplace is requiring you to get tested, you must continue getting tested. That's it.
Yes, so I know that there's been some conversation, and yesterday we are aware that CDC made a statement and provided some recommendations related to the use of face masks. So just to kind of follow on Jorge's comments, we are still in Imperial County and we're still waiting for state guidance on those recommendations. Again, we always follow our state guidance as they may be stricter. Each individual state's guidance may be stricter than what the federal standards may be. Again, these are recommendations. They're not requirements that the CDC puts out. So we just want to remind people that we're still following some guidance from the state. Once that is released, then we will provide an updated information to the community. So we just kind of wanted to provide some clarification on that nothing has changed in terms of, there's a lot of things that have changed. Like Jorge said, we're able to now gather with our families and with some of the people that we're close to in those smaller settings without a mask. If we all are vaccinated, we're able to resume some of those normal activities that we were not able to do at all prior to vaccination. So we really want to encourage people to continue to get vaccinated so that we can continue to expand on that. And as we continue to reopen and be more lenient with some of, not just us, but as we receive guidance for more leniency and putting away some of these protective measures, that we have more immunity in our community by having more people vaccinated as well. Some of the things that if you do get vaccinated, as Jorge said, that you still want to continue to do is we still need to follow our business and work plan guidance. So you may still be required to use a mask even if you've been vaccinated, if that entity requires it because of regulations. If you travel, you may still be required to wear a mask on planes, buses, trains, and other forms of public transportation. Fully vaccinated, again, like the travel, in terms of travel, that has changed. Although people arriving in the United States through international travel are still required to get tested before their flight, and are recommended to also get tested after they arrive as well, especially as we're learning about and hearing more about more variants in other countries as well. You should still watch out for symptoms of COVID, especially if you've been around someone who's been sick. If you have any symptoms, you can get tested and stay home and away from others. If you're asymptomatic and you've been vaccinated, you can continue on with your duties, and you do not have to quarantine. You do not have to get tested. However, if you always want to follow any guidance depending on where you live, or like the workplace guidance or a business guidance that has been set, that might be a little stricter than that. Also, people who have a condition or are taking medications that may weaken their immune system, they should talk to their healthcare provider to discuss activities and any additional precautions that they may need to continue to take to prevent COVID, to ensure that they stay safe. As we know, as we've heard, the vaccine, although it's very highly effective in preventing COVID, there are cases you can still get COVID. The hope with the vaccine, and when we look at the function and we've seen the results of the vaccine, is that it works in the sense that decreases the complications of COVID, the hospitalizations due to COVID, and so that's why it's so important. But there's maybe some individuals that still want to take those extra precautions, and we just want to say, that's okay, and talk to your health care provider to ensure what's safe for you. And although we talked about what we can do and we talked about what we should keep doing, And we know that state and federal guidance change from day to day, sometimes from morning to night. We're just trying to stay on top of it as much as we can and trying to inform our community as best and as much as we can. We have made some significant progress against COVID, and the state has administered more than 20 million vaccines in California, and cases and hospitalization rates have stabilized throughout California. And as a result, California has begun preparing to move beyond the blueprint of the safer economy, which are all these guidelines that we still have in place that we must still follow. Earlier, maybe last month or 2 months, I think it was last month, that the governor announced that on June 15th, California will fully reopen its economy across the state if there is enough vaccine supply for Californians. It was 16 and over, now it'll be 12 and over that would be updated, or anyone that's eligible to receive the vaccine. And also hospitalization rates remain stable and low, especially among fully vaccinated Californians. So those are the two areas or metrics that we continue to keep an eye on, that California keeps an eye on as we continue to prepare for a fully reopening. It doesn't mean that all guidance and all measures that have been in place will go away. We're still waiting for additional guidance as to what it means to fully reopen and what that looks like as of June 15th. As we receive more information, as we prepare further, and as that date gets closer, we will continue to share with the community and with our businesses so that we're all prepared for that. Some of those common sense health measures, including the wearing of masks, may still continue. Testing and vaccination requirements will remain for some businesses and some industries that remain at high risk regardless. For more information on this, you can always visit covid19.ca.gov website, which provides a wealth of information related to vaccination rates, statewide, local, information on the blueprint for safer economy, guidance, the current guidance, and a lot more. Testing information, anything you want to know about COVID throughout the state and what they provide, you can find on this website. And that is all we have today for you in terms of information. I don't know if we have any questions that we can help answer at this time. I don't see anything on the chat box. Okay, is there anything else you would like to add that I may have missed?
I think we covered everything pretty well.
Okay. Well, again, we want to say thank you all for joining us today. We want to encourage anyone, if you know anyone that hasn't received the vaccine, to encourage them to get vaccinated, and also, you know, if they need help to find an appointment, because we know that not everyone is techie savvy, not everyone knows how to go and find MyTurn and find an appointment and register. You know, you can always call that website, on MyTurn, the number to get to be able to make the appointment. That's 1-833-422-4255. Again, that's 1-833-422-4255. For those that don't have a computer, for those that may not have access to a computer and want to share that number with those individuals so that they can call and make their appointment wherever it's closest, MyTurn, Vaccine Finder, or ask your doctor if they're providing the vaccine. Most community clinics in our community are providing the vaccine throughout the county. So there are different places where you can go. It's become more accessible. The more we all get vaccinated, the more we reach immunity, the more we get back to our new normal. and be able to do a lot of those activities that we're so anxiously waiting to be able to do and resume to what life was before COVID, or close to what life was before COVID. So really encouraging you to assist those if you know of anyone, how to find that information. You can always also go to our public health website to get that information, as much as in terms of data, in terms of educational, frequently asked questions. We try to make that information accessible as well. So thank you all, and have a great day, and stay safe out there, especially now that the heat's out here too. Bye.